Hello guys, this is Indian Medico, and in this video we are going to see about Sildenafil. This is a concise presentation for medical students. Sildenafil is an oral medication which belongs to a class of drugs called phosphodiesterase 5 inhibitors. They are also known as PDE5 inhibitors. Drugs which are similar to sildenafil include vardenafil, tadalafil, and avenafil. And let us see about the mechanism of action of sildenafil. Sildenafil selectively inhibits cyclic GMP specific phosphodiesterase type 5. This is found in corpus cavernosum of penis and in smooth muscle of pulmonary vasculature. By inhibiting cyclic GMP specific phosphodiesterase type 5, the levels of cyclic GMP are elevated, which leads to relaxation of smooth muscle in penis and pulmonary vascular bed. This leads to increased blood flow into corpus cavernosum, leading to erection and also vasodilation of pulmonary vasculature. Now let us see about the clinical uses of sildenafil. Sildenafil is used in the treatment of erectile dysfunction and pulmonary arterial hypertension. Now let us see about the side effects of sildenafil. Headache, flushing, impaired blue-green vision, and dyspepsia or indigestion are the various adverse drug reactions of sildenafil. Now let us see about a contraindication for the use of sildenafil. Sildenafil is contraindicated in patients who are taking nitrates. This is because there is a risk of life-threatening hypertension in these cases. If you have any suggestions, please let me know in the comment section. For more such videos, please check out my pharmacology playlist. If you like my videos, kindly subscribe. Your subscription will encourage me to make more videos. Thank you.